even during Ramadan, we are currently fasting, but we are still up and about doing our daily activities, hosting the show, for example, which means that fasting doesn't really take a lot out of you, or does it, Mio?
It does not. It definitely does not. It should not be a reason for you to be down and out. It should not be a reason for you to be all lethargic and tired. It should not. Whereas it should actually bring you up even further, because we have a guest today who's going to be supporting our hypothesis.
Yes, wouldn't it be nice to find out how fasting is helping us through science? Because we have an expert in the studio. Let me introduce to you Dr. SYAZANA, ALIA SABRUDIN, who is Medical Officer from Public Health Clinic, Section 19, Shah Alam. Dr. SYAZANA, welcome to the show.
Thank you.
You have been on the show before. We have been talking about fasting, intermittent fasting, but today is going to be a bit different. It's going to be about fasting and science, which is very interesting because I would like to know how is our body benefiting from all this fasting from the scientific point of view. You're a doctor, you would know. I think first of all, we can actually ask you straight out of the bat, how does fasting help with the body? Can you explain on that?
All right. First of all, hi, I'm SYAZANA, Dr. SYAZANA from Clinic Kesihatan 19, Section 19, Shah Alam. So I deal with chronic diseases patients every day, like diabetes, hypertension, heart disease. So this topic is a very dear topic to me, as fasting could be part of our management as well in primary healthcare. So regarding to benefits of fasting, besides, fasting has become a popular method for people who would want to manage their weight and lose body fat. The benefits goes beyond than that. So research and studies has been done a lot to prove benefits of fasting, and there's one of it. There's a significant effect on insulin level and also human growth hormone, which are like two key hormones in our body. So, for instance, like SHAH or human growth hormone plays a very important role in reparative hormone, like repairing our muscle tissues, brain tissues. So there's a study that shows that someone who fasts for 3 days could increase the SHAH level up to 300%, while by 7 days could increase up to 1,250%. So for instance, like someone like me, I'm a fitness enthusiast. So I treat fasting as like my off-season time. Yeah, so
it's time for you to lay low and chill.
Yes,
right?
let like everything inside to heal, repair properly, so I can, if I have a next target, next race or event I want to go on, I could perform better. And besides that, as I mentioned just now, like it could regulate our insulin level. So actually, there are studies that shows that fasting could help in early treatment of pre-diabetes and also early stage of diabetes, because fasting lowers your blood sugar, hence also improves insulin sensitivity.
I mean, one thing that a lot of people may not actually realize is, I remember the time where I had a chance to speak to some of my foreign friends who are not actually Malaysians, who are not actually Muslims, and they always say that this is actually a diet thing that you're doing. You're restraining yourself from eating, from drinking, and it's gonna give you a lot of bad repercussions because of it. What they don't realize is that the fact that we Muslims specifically, we've been doing it for thousands and thousands of years, and we actually have seen a lot of benefits, health-wise at least, that not only it repairs ourselves internally, but it generates a lot of new spirit, should I say? I mean, in regards of just making yourself better physically as well.
Correct, true. There are also several studies that shows that fasting could help to improve insulin sensitivity to control the oxidative stress in your body. So as you mentioned earlier just now, as it helps to repair like physically. So how it does is, we secrete oxidative stress every day. So this oxidative stress controls our cortisol, which is our stress hormone, blood glucose, inflammation, immune system, and metabolism. If it gets too high, it's not good. So we fasting is a way to actually helps to balance it. And at the same time, when you control your oxidative stress, you also control your inflammation inside the body, which correlates with our immune system.
It's like a master reset button for you just to regulate your body
Yes.
back again, to make it normal as it was before.
Yeah, and that's very interesting, isn't it? But I guess my question right now is, you are talking a lot about the benefits of fasting. So I guess it's good for the body to take some time off
Yep.
and to just go on fast.
Yep.
And apparently there are so many benefits, but can we do fasting every day, doctor? For example, let's say instead of just for Ramadan, I want to fast for 2 or 3 months. Would that be beneficial for the body, or is that a bit too much of fasting? What do you think?
It depends on how. Okay, so like I think like in a previous session, I talked about intermittent fasting. Like right now, the one that is relevant to what we are going through, the holy month of Ramadan, is a form of dry fast.
Yeah.
So we fast. We as Muslims, we fast from dawn to
sunset.
And restraining ourselves from eating and drinking. So it's a type of dry fast where there are other types of fasting where they fast for 16 hours and 8 hours is their window period of eating. But within these 16 hours, they allow themselves to drink plain water, black coffee, anything that has 0 calories.
I see.
So there are some people who would do that for 3 months, half of a year, or even longer than that. I've read a few studies that it helps in their health and also in their health as well, such as improving their cardiovascular system, the heart health, as it helps to regulate your triglyceride, cholesterol level, and also improves the brain power as well. So yes, you can fast, but you need to consider your other commitments as well. Like what is your type of physical activities? What do you work as? Is it sustainable for you?
Right,
Yeah.
I guess it all comes down to moderation at the end of the day.
Exactly,
Don't
exactly.
be too engulfed with whatever it is that you do, not just in fasting, but anything else in life as well. You have to take it in moderation, and you need to take it step by step, one by one, and not to overdo it. I mean, at the end of the day, even like something which is good for you, if you take it too much, then it's going to be bad for you at the end of the day as well.
That is why for children, we, in order for us to encourage them to fast, we don't ask them to fast the whole day.
Yeah.
In the first place, we ask them to fast half day,
Right.
and we'll see whether full day for first few days. That's how it is.
Baby steps.
Baby
Well,
steps.
Yeah, he started only about a couple of years ago. So
I
kidding.
mean,
2 years ago, it was only half a month.
congrats then still. I mean, it's a form of lifestyle,
Thank
not
you.
just a spiritual way, but yeah.
I'll try to be better. Hopefully,
How
for entrepreneurs,
honest doctor is to you, man. Oh my God.
Alright.
Oh yeah, but one other thing that I've actually read up as well is about your immune system as well.
Yep.
Fasting
Yep.
helps to better your immune system internally. Elaborate on that, please.
As I mentioned just now, fasting can help to regulate your oxidative stress. So this oxidative stress, the key hormones that actually was secreted by it is the cortisol level. So we produce cortisol level every day, but if it gets like too high, and we're exposed to stress every day. So if it gets too high, then we release like lots of free radicals that could be some sort of like toxins to our body. So fasting helps to reduce these free radicals by reducing this cortisol level, hence reducing inflammations in our body and improves our immune system. Yeah. Actually, there's a research done that by this place in Mount Sinai that says that fasting reduces inflammation in chronic inflammatory diseases without affecting immune response to acute infections as well. Yeah, if it's done properly.
Sure. And speaking of inflammation, I know a perfect way to.
Why are you looking at me there?
No, no. I'm not looking at you. I'm just gonna ask the question because I know a perfect way of inflating yourself before going to sleep and talking about
Is it?
sahur.
Is it?
Yeah, yeah.
Okay.
Because I usually after sahur, sometimes if I were to go to sleep right after subuh, after sahur, I would feel so bloated and waking up in the morning is not nice. I wonder because sahur is an integral element of fasting in the Ramadan because that's how we prepare to go all day long without any food, right?
Yep.
I wonder, is there any correlation between going to sleep straight after, or should we actually wait a few hours before we go back to sleep, or should we not just go back to sleep? Should we just continue our day from sahur onwards? Do you have any
I would
tips
say
on
the
that?
type of food that you take during sahur.
Yeah. What do you mean, doctor?
So, like in our culture, our food is rich in carbohydrates. Yeah. I would say the recommended way in order for you to sustain your whole day, reduce the bloatedness, reduce the lethargic feeling and everything,
Yes.
would be take low carbohydrates, high protein, with a little bit fat, say like oil and everything as well. Because if you take like too much carbs, your blood sugar will spike fast, but only for a certain period of time. So that's why, like in the afternoon or probably like around 11 a.m., like this time around, you would like crave for something already.
I'm feeling it right now. I understand.
Yeah, and then how you break fast is also important. Yeah.
I wonder, doctor, if you can enlighten us on the examples, because you mentioned protein and carbs. Can you give us some
What would the
examples?
best type of food that one should consume during sahur?
Okay, if you have no allergies to like certain kind of proteins, eggs would be like very easy to prepare for sahur. Anything that you prepare earlier, meal prep earlier, like chicken breast, fish as well. That would be a bit hard to prepare for sahur, but I take like eggs personally, with a little bit of rice. I love rice. I mean, yeah, you can prepare like overnight oatmeal and everything, but it's I would stick to my staple, like quarter of rice, 2 eggs, a little bit of veggies and fruits.
So
Lots of water.
So nasi goreng ikan masin with telur mata.
Boleh, can.
Yeah, because someone...
Can.
I know someone would love to eat that
yeah,
during sahur every single day.
That sounds so good right now, by the way.
Exactly.
But just the amount of it, the amount of rice.
The amount of rice, yeah. It's all, I mean, it all depends on really however it is you proportion,
Yes,
exactly. all your intake. Even like you say, even for berbuka as well. So what are the do's and don'ts when you want to break your fast?
For breakfast, in terms of your macros, I would say I would
Should
recommend...
you still do your quarter half thing?
I'd say still high protein.
Okay.
And medium or moderate amount of carbohydrates, fibers, lots of fibers, and also a little bit fat. Yeah, I still, that is especially if your aim is for body fat loss. Yeah.
Sure.
Yeah, so those are the kind of things that you need to be aware of.
Yep.
So, okay, we're running out of time actually, but we do want to give you another chance for you to just address to our audience, just to give them a bit of a reminder that we are only very much in the early stage. We're only 1/3 in of Ramadan.
Yeah.
Just to give them a bit of a, like keep it going, don't stop. I was about to sing there. Please, doctor.
All right. Fasting has shown there's a lot of benefits to our not just physical but also spiritual health. Then again, having said that, fasting is not the only element in order to ensure one's health. So it needs to be complemented with regular physical activities, good and well-balanced diet, and also well-managed of stress as well.
Yeah, exactly. And it also doesn't mean that if you're fasting, you can't go for a quick run, you can't go for a quick jog, you can't do...
You just have to reduce the intensity and focus on the fast.
Rather than
as well.
running 10K, you can run 3K or 4K.
It's also reminding me on how I'm missing out on my exercise schedule. Thank you so much, doctor.
You're welcome.
It looks like I'm going to have to go and do all that.
You got a bit of a scolding today. Thank you, Dr. SHAZANA.
Thank you so much.